as women age, the vaginal tissue can become atrophic. And when the tissue becomes atrophic and dry, they're more prone to having urinary tract infections. So one of those natural barriers in resistance to urinary tract infections is having moisture in the vagina. And as the estrogen leaves the system, the tissue becomes dry and brittle and can crack, and then that gives an entry point for bacteria. Then the first 10 years after menopause, most women will have some mild atrophy, usually not severe. The second decade, it'll be moderate, and once a patient, say more than 20 or 30 years into menopause, they will have severe vaginal atrophy. It's universal, it's inevitable, and that's what will eventually become apparent in that patient. Patients who are open to the idea of taking estrogen, especially vaginal estrogen, we'll have that discussion with them. But taking estrogen these days is very controversial, and the pendulum tends to swing back and forth on the use of estrogen in women. But I still feel that even in the patient that has atrophy, if you can correct that, that's usually not enough in order to prevent the urinary tract infections. It will usually lessen the infections, but they still need a strategy for when they do get an infection. And many older women are being sexually active into their 70s, into their 80s. And for that population, you can use a product like Allura, similar to you would use in your younger patients.